Having a new baby should be a joyful time, but it comes with new anxiety and a lot of questions because of the coronavirus outbreak. Dr. Reena Mehta joins us via FaceTime this morning to break down some of those concerns. Hi, Dr. Mehta.
Hi, good morning, Meg.
Good morning. All right, so first of all, if you're pregnant, can pregnant women transfer the coronavirus if they catch it to their unborn child?
So that's a great question. And so far we've had limited studies, but the current studies have not shown that coronavirus can be transmitted through maternal fluid, such as amniotic fluid, or through the placenta. So at this time, we have not been able to observe that coronavirus can be transmitted from mother to baby during pregnancy.
If a woman is pregnant and gets the coronavirus, will she be sicker than someone who's not pregnant?
That's also a great question. So at this time, what we're finding is that pregnancy does not confer any increased risk for developing more severe symptoms. So a pregnant woman who is otherwise healthy and doesn't have other underlying medical condition typically has the same risk severity of getting the same type of illness as somebody who's not pregnant. And so, of course, the women who do have underlying medical issues, such as diabetes or high blood pressure, also do have a higher risk of getting more sick with coronavirus, but pregnant women who are otherwise healthy do not have any increased risk of having a more severe illness.
Now, once the baby is born, I've heard that newborns can contract COVID. Is that correct?
So after the baby is born, the baby would have the same risk as any other human would be, because the risk of contracting the virus through respiratory droplets is a thing, and that can happen in anybody. But right now what we're finding is that the virus is not transmitted in utero during pregnancy, and we're also not able to detect it in breast milk at this time as well.
Okay, so it's safe to breastfeed your child if you don't have the coronavirus.
So if you don't have the coronavirus and would like to breastfeed your child, yes, it is absolutely safe. Breast milk actually contains a lot of good nutrients and antibodies that protect you against infection. And so if you are able to breastfeed and you are not sick, I would recommend continuing to do so, because at this time we have not found that coronavirus can be transmitted through breast milk. Now, let's say if you are pregnant or you just had a baby and you are planning to breastfeed, then the question becomes, okay, I would like to breastfeed, but I do have the coronavirus. Is there a safe way to be able to breastfeed? And what I would suggest, the CDC is giving two options. Option number one would be to pump. And so when you pump, you want to make sure you wash your hands and do good hand hygiene before and after you touch any pump products. And then you should have a caregiver who is not sick feed the baby. And then option number two is, if you are going to breastfeed, to wear a face mask and obviously wash hands before and after you touch the baby.
So for couples out there that are thinking about maybe getting pregnant, do you think they should wait until this is over? Do you think it's safe to try now?
So of course that's a personal choice, and that's a discussion that anybody should have with their gynecologist or OBGYN or healthcare provider. But I think you have to think about it as a whole. You have to think about, well, if you would like to get pregnant, what are my health risk factors? If I'm otherwise healthy, you may think about, going ahead and getting pregnant. It just depends. It's a personal choice, and you just have to kind of think about it. But you should know that based on studies, there is not an increased risk of transmission that we know of during pregnancy or through breastfeeding.
Now, back to newborn babies. Obviously we've said that newborns can contract COVID-19. They have the same risk as anyone else, but we know that new babies don't have any of their vaccinations yet. They're more susceptible to getting sick. So could that pose a problem if the baby does get COVID? Could they see more serious symptoms?
That's a great question. And so when a baby is born, they actually, through mother, they actually get protective antibodies for the first several months of life. And so even though a baby doesn't have their initial vaccinations, they do get maternal antibodies that comes through the placenta during pregnancy that then does protect them against illnesses. So what we are finding now is that babies, while they can get coronavirus, do not seem to be getting more sick than anybody else in the general population. So that's good news. But of course, you want to take your typical precautions. If you know somebody, or if you have a family member who does have coronavirus, you do want to stay away, keep social distancing, always wear face masks with good hand washing. But at the time, it doesn't seem that babies are getting more sick than anybody else if they were to get coronavirus.
All right, that is good to know. Dr. Reena Mehta, thank you for your time this morning. We appreciate it.
Thank you so much for having me.